If your legs cramp at night, if your feet tingle so badly they wake you up, if by evening your legs feel heavy, tight, almost like they're filled with sand, and your doctor told you to take magnesium, you need to hear this. Because magnesium may be helping the symptom, but it is not fixing the real problem. And that's why the cramps keep coming back. I'm Dr. Emily Carter, and today I'm going to explain something that completely changes how we look at circulation after 60. In the next several minutes, I'll show you why magnesium falls short for leg circulation. What is actually happening inside your blood vessels? The one vitamin that restores blood flow at the source, and how to use it safely and effectively. And if you've tried magnesium before, I want you to comment below. Did it work? And if it did, how long did the relief last? I read every comment, and your experience helps others. Now let's talk about magnesium. Why magnesium isn't the full answer. Magnesium has become the default solution for leg cramps. Mention nighttime cramping in a pharmacy, and you'll walk out with magnesium. And to be fair, magnesium does help with muscle relaxation. It helps muscles contract and release properly. It may reduce some cramping, but here's the truth most people never hear. Magnesium does not improve circulation. It does not open narrowed arteries. It does not increase oxygen delivery to tissues. It does not remove plaque. It does not reverse arterial stiffness. And after 60, poor circulation is usually the real issue. Let me explain this clearly. Imagine your circulation is like a highway system. If traffic slows down because the roads are narrowing, magnesium is like adjusting the radio in your car. You might feel slightly better, but traffic is still stuck. The problem is not the muscle. The problem is blood flow. The 4 problems with relying only on magnesium. Problem 1. It does not dilate blood vessels. Magnesium relaxes muscles, but it does not actively expand arteries in a meaningful way. And if your leg pain is coming from restricted blood flow, you're treating the wrong system. Your muscles cramp because they're not getting oxygen. Without oxygen, muscle fibers panic. They tighten. They cramp. Magnesium calms the muscle, but the oxygen shortage remains. Problem 2. Digestive side effects. Many seniors cannot tolerate magnesium well, especially magnesium oxide, which is the most common form. It often causes diarrhea, stomach cramps, nausea, bloating. And if you already have digestive sensitivity after 60, this can make things worse. So people lower the dose, or stop taking it, or take it inconsistently, which leads to inconsistent results. Problem 3. Medication interactions. This is important. Magnesium can interfere with antibiotics, blood pressure medications, bone medications, certain diuretics. In some cases, combining magnesium with blood pressure medication can drop pressure too low or cause irregular heart rhythm. This is not common, but it is real, and it's often overlooked. Problem 4. Temporary relief. This is what I see most often. Magnesium works for a few weeks, then the cramps return. Why? Because circulation never improved. The arteries are still stiff. The blood is still struggling to reach your calves and feet. The muscle relaxed, but the highway is still blocked. And that's where most people stop. They assume, well, this is just aging. But it isn't. Now let's go deeper. Because once you understand what is happening inside your blood vessels, everything makes sense. After 60, your arteries do not behave the same way they did at 40. They slowly lose elasticity. The inner lining of the vessel, called the endothelium, becomes irritated. Inflammation increases. Cholesterol particles stick more easily. Plaque begins forming. Blood vessels narrow, and blood moves more slowly. This process is silent. It happens gradually. You don't feel it in the beginning, but your body notices. The early warning signs. Your body always whispers before it screams. Here are the 5 signs that your circulation is already compromised. If you recognize even one of these, pay attention. Warning sign 1. Changes in skin color. Have you noticed your feet looking pale, or slightly bluish, or darker in patches? That is not cosmetic. That is oxygen deprivation. When blood flow decreases, oxygen delivery drops, and skin changes color because it is literally starving. Those areas often feel cold, heal slowly, develop cracks, become prone to infection. That is your first warning. Warning sign 2. Cramping when walking. If your calf cramps while walking and you have to stop, and then it improves when you rest, that is called intermittent claudication, and it means your muscles are not getting enough oxygen during movement. This is not a magnesium problem. This is a blood flow problem. At night, when you lie down, blood pressure shifts, circulation patterns change, and the muscles protest again. Warning sign 3. Tingling and numbness. That pins and needles sensation, especially in the toes or the bottoms of the feet. That is nerve tissue not receiving steady oxygen. Nerves are extremely sensitive to blood flow changes. Without proper circulation, nerve signaling becomes unstable. Over time, this affects balance, which increases fall risk dramatically. Warning sign 4. Cold feet on warm days. If everyone else is comfortable and your feet feel like ice, that means blood is not reaching the extremities. I have patients who wear socks to bed in summer. That is not normal aging. That is vascular stiffness. Warning sign 5. Varicose or spider veins. Bulging veins, twisted dark lines, heaviness at the end of the day. This happens when blood pools. Vein valves weaken. Flow becomes inefficient. Again, this is not primarily a magnesium issue. This is structural circulation decline. Now here's the key. All of these symptoms have one common root: restricted blood flow. Not muscle tightness, restricted blood flow. And this is where the vitamin I'm about to reveal changes everything. Because it does something magnesium does not. It opens the vessel. It restores the pathway. It improves the highway system. The vitamin that restores blood flow at the source. The vitamin that addresses circulation at its root is vitamin B3, also called niacin. And here's why it works. Vitamin B3 triggers vasodilation. When you take vitamin B3, your body releases compounds that cause blood vessels to expand. This is called vasodilation. The arteries literally widen. Blood moves more freely. Oxygen delivery improves. Tissue function improves. The kinked hose opens. That warming sensation some people feel, called the niacin flush, is not dangerous. It is blood vessels expanding. That is circulation improving in real time. Magnesium relaxes muscles. Vitamin B3 opens arteries. Completely different mechanism. Benefit 1. Increased oxygen delivery. When vessels widen, muscles receive oxygen. Nerves receive oxygen. Toxins clear more efficiently. This reduces cramping, tingling, cold sensation, heaviness, often within weeks. Benefit 2. Cholesterol improvement. Vitamin B3 lowers LDL, bad cholesterol, raises HDL, good cholesterol. HDL helps remove plaque from arteries. Less plaque means wider pathways, better circulation long term. Magnesium does not do this. Benefit 3. Reduced vascular inflammation. Inflammation stiffens arteries. Vitamin B3 has anti-inflammatory effects on vessel walls. This restores flexibility. Flexible arteries equals better blood movement. Benefit 4. Reduced clot risk. Better flow means less stagnation. Less stagnation means lower clot risk. For seniors, this is extremely important. Because circulation issues increase risk of stroke, deep vein thrombosis, pulmonary embolism. Improving flow protects you. In studies, seniors increasing B3 intake showed significant reductions in leg cramping and improved walking distance within 2 months. This is not alternative theory. This is physiology. Why B3 deficiency is so common after 60. Here's what most people never get tested for: vitamin B3 deficiency. And yet, it is extremely common after 60. Why? There are 4 main reasons. Reason 1: reduced absorption. As we age, stomach acid decreases. Less stomach acid means poorer nutrient absorption. Even if you eat well, your body may absorb far less B3 than it did at 40. Same meal, different outcome. Reason 2: medications. Many common medications deplete B vitamins, especially statins, blood pressure medications, certain diabetes medications. And since most adults over 60 take at least 1 prescription, depletion happens slowly and silently. Reason 3: lower protein intake. Many seniors eat less meat and fish, sometimes because of appetite, sometimes because of chewing difficulty, sometimes because of fear of cholesterol. But the richest sources of B3 are chicken breast, salmon, tuna, turkey, lean beef. When protein intake drops, B3 intake drops with it. Reason 4: chronic inflammation. Inflammation increases nutrient demand. The more inflammation in your body, the more B3 your cells require. And if intake does not match demand, deficiency develops. Slowly, quietly, until symptoms appear. How to restore B3 safely. Now let's talk practical steps, because this is where real change happens. Step 1: increase B3 through food first. Best natural sources: skinless chicken breast, salmon, tuna, turkey, eggs, almonds. 100 grams of chicken breast provides over half of daily needs. A serving of tuna can provide almost the entire daily requirement. Almonds provide about 1/4 of daily needs per handful. Step 2: understand recommended intake. For adults over 60, women, 14 to 16 milligrams daily. Men, 16 to 18 milligrams daily. However, if you are already deficient, therapeutic doses under medical supervision can range from 100 to several hundred milligrams. Important: higher doses should always be supervised. About the niacin flush. Some people experience warmth, redness, tingling of the skin. This lasts about 15 to 30 minutes. It is not dangerous. It is vasodilation, your vessels opening. If uncomfortable, use time-release niacin, or increase intake gradually, or focus on food sources. Real-life example. Let me tell you about Margaret, 67 years old, severe nighttime leg cramps, cold feet constantly, heavy legs every afternoon. Her doctor gave her magnesium. It helped slightly, but the heaviness remained. Her feet stayed cold. When we reviewed her diet, very little protein, mostly toast and cereal, almost no B3-rich foods. We added 1 daily serving of chicken or fish, a handful of almonds. Within 2 weeks, night cramps reduced. By week 4, almost gone. By week 8, warm feet, longer walks, better sleep, more energy. Nothing extreme, no complex protocol, just correcting a deficiency. Your action plan starting today. Step 1. Look at what you ate yesterday. Did it include B3-rich foods? Step 2. Add 1 B3 source today: chicken, tuna, eggs, almonds. Step 3. Move every hour. Even 5 minutes improves circulation. Step 4. Hydrate. Dehydration thickens blood. Step 5. Reduce processed sugar. Inflammation stiffens arteries. Step 6. Track your symptoms for 4 weeks. Consistency changes biology. The big takeaway. Magnesium relaxes muscles. Vitamin B3 opens blood vessels. If your problem is circulation, you must fix the vessel, not just the cramp. Better circulation means better brain function, better heart health, stronger legs, better balance, better sleep, more energy, greater independence. After 60, circulation is everything. Before you go, comment your age and where you're watching from. Have you tried magnesium? Did it truly solve the issue long-term? If this helped you, share it with someone who struggles with leg cramps or cold feet. Small knowledge can prevent big complications. I'm Dr. Emily Carter. Stay strong, stay mobile. And remember, better circulation starts with small steps today. I'll see you in the next video.